Kidney renal failures. Kidney failure mean a complete or partial failure of kidney to function. Diabetes, mellitus, and hypertension are leading cause of kidney failure. In certain cases, sudden interruption into the blood supply of kidney and drug overdoses may also result in the kidney failure. The main symptom of kidney failure is the high level of urea and other wastes in the blood, which can result in vomiting, nausea, weight loss, frequent urination, and in blood in urine. Excess fluid in the body may also cause swelling of legs, feet, face, and shortness of breath. The kidney failure is treated with dialysis and the kidney transplant. Dialysis. Dialysis means the cleaning of blood by artificial way. There are two methods of dialysis. Peritoneal dialysis. In this type of dialysis, the dialysis fluid is pumped out into the peritoneal cavity, which is spaced around the gut. This cavity is lined by the peritoneum. Peritoneum contains blood vessels. When we place dialysis fluid in the peritoneal cavity, waste material from the peritoneal blood vessels diffuses into the dialysis fluid, which is then drained out. This type of dialysis can be performed at home, but must be done every day. Second, hemodialysis. In hemodialysis, patient's blood is pumped through an apparatus called dialyzer. The dialyzer contains long tube, the wall of which act as semi-permeable membrane. Blood flows from the tubes while the dialysis fluid flows around the tubes. Extra water and wastes move from the blood into the dialysis fluid. The cleansed body is returned back to body. The hemodialysis treated are typically given in the dialysis center 3 weeks per time. Kidney transplant. We know that dialysis need to be repeated after every few days and is unpleasant for patients and attendants. Another treatment for the end-stage kidney failure is kidney transplantation. It is replacement of patient's damaged kidney with donor healthy kidney. Kidney may be donated by the deceased donor or living donor. The donor may or may not be relative of patient. Before transplant, the tissue or protein of the donor and patient are matched. The donor's kidney is transplanted in the patient's body and is connected to the patient's body and urinary system. The average lifetime for donated kidney is 10 to 15 years. When a transplant fails, the patient may be given a second kidney transplant. In this situation, the patient is treated through dialysis for some immediate time. Problems after which transplant may include transplant rejection, infection, imbalances in body salt, which can lead to the bone problem and ulcer. Analyzing and interpreting. Rationalize which why dialysis machine is considered as artificial kidney. Design dialysis apparatus can be cell phone, paper, and empty photographic films. The terms to know: Bowman's capsule, collecting duct, dialysis, dialyzer, distal convoluted tubule, excretion, glomerular filtrate, glomerulus, guttation, hemodialysis, hilus, homeostasis, lithotripsy, loop of Henle, nephron, osmoregulation, papillary duct, peritoneal dialysis, pressure filtration, proximal convoluted tubule, renal corpuscle, renal pelvis, renal pyramid, renal tubule, selective reabsorption, tubular secretion, ureter, urethra, urinary bladder, urinary system. Examine the structure of kidney, sheep or goat kidney model. Trace the movement of molecule of a urea from blood to urethra using a flowchart diagram. Science, technology and society. Realize the importance of drinking plenty water daily. Predict how the kidney help to overcome the problem of dehydration. Recognize the right treatment of kidney problem. Understanding the concept. Describe the process of selective reabsorption in the kidney. How do plants excrete extra water and salt from their bodies? What is function of kidney? Describe the structure and broad label of kidney. What steps are involved in the formation of urine in the kidney? Along which excretion kidney also play a role in osmoregulation. Comment on this statement. Review questions. Multiple choice. The human urinary system consists of rectum, lungs, kidney, ureter. Beta. Kidney, ureter, urinary bladder. C. Skin, silver, liver, lungs, kidney. Delta. Kidney, ureter, urinary bladder, urethra. Which organ is responsible for filtering of blood? Alpha, intestine. Beta, brain. Charlie, stomach. Or delta, kidney. The tube between the kidney and urinary bladder is alpha, ureter. Beta, urethra. Charlie, renal tubule. And delta, nephron. Body balance of water, salts, temperature and glucose termed as alpha, excretion. Beta, tubular secretion. Charlie, homeostasis. Delta, reabsorption. Which is correct order for the path taken by urine after it leaves the kidney? Urethra, bladder, ureters. Bladder, ureter, urethra. Ureters, bladder, urethra. Bladder, urethra, urethers.